Hello, everyone. Dr. Jean-Pierre here, your Nuka chiropractor, and welcome to another live. Today, we are talking about chronic ear infection and sinus infection. So I have a little bit of information for you. This live is going to be a little bit shorter than most because there's only so much that we can talk about. But as always, questions are welcome. The more questions I have, the more answers I can give. So today is about chronic ear and sinus infection. See, the thing is, though, if you have or you know someone that have chronic ear and sinus infection, the last place you're going to take them is to a chiropractor. All right. And I understand that because we've been pigeonholed into thinking that chiropractic is all about taking care of your neck and back pain. So yeah, if you have a headache or a neck pain or back pain, then just like, all right, let's go to a chiropractor. But what the heck can a chiropractor do about chronic ear or sinus infection? Well, that's what we're going to talk about today. So stay tuned as we talk about this. And as always, I'm going to put this right in front. I'll repeat it again. For every one of you that are listening, that are a follower and that listen to these talks, I always give a special offer. Again, when you come into the office to do the examination, you should get $500 visit. But for you that listening, I'm going to give you a $200 gift card that you can use towards that. So if you are listening or you know somebody that could use that, $500, but we're going to give you $200 off. But that's only if you call today. Okay, today. So if you call tomorrow or you're watching this later on, that doesn't count. Stay tuned for the next live in 2 weeks, and then maybe you can get that. But $20 discount. All right. So let's get into it. When you're talking about chronic ear infection, the ear, what does that have to do with upper cervical? But first, let's talk about the anatomy of the ear. So when you see this here, this is not the entire ear. This is just the outer ear. This is what you can see. Now the ear, then it goes to the ear canal. Then you have what's called the middle ear. The middle ear is where the eardrum is. Okay, and then after that you have the inner ear. Now connecting the from the eardrum all the way down is what we call the eustachian tube, and that eustachian tube goes all the way and create all the sinuses here and goes all the way down to the throat. So a doctor that people would see for that is called an ENT, and the ENT is ear, nose, and throat. And the reason for that is like why one doctor looking at those three regions, that's because they're all interconnected. So if you ever had a sinus infection or anything, you can see that your ear may hurt. You have congestion here in the nose, around the eye here and here, and sometimes you may have a sore throat and things like that, because all these things are connected through the eustachian tube that goes down to the esophagus and also goes to the tonsils, and you have sinuses here. All of these things are connected through the eustachian tube. So that's kind of the anatomy of the ear. You have the outer, you have the middle where the eardrum is, and the eardrum is just a flap that allows air to go through, so it creates equilibrium between the outside air and the inside air. Okay, so the eustachian tube is just a valve that connects the back of the nose to the middle ear and allow air to enter behind the sealed eardrum. All right. That eardrum normally opens and closes, and that equalizes pressure from the outside. So a good example of that, if you ever climbing up, let's say airplane. When you're in an airplane, you hear the popping sound. That's allowing the eardrum to equalize the pressure from the inside and outside. So that's important. So when you don't have that, that can cause inner ear disorders. So those muscles are responsible for opening the eustachian tube and directly controlled by nerve fibers to the top of the neck. That's one of the reasons why we'll be able to help you, because the eardrum, the eustachian tube, is controlled by nerve fibers that are right there in the top of the neck. So here's the thing. Now, we'll break this down into two. We'll talk about children first, and then we'll talk about adults and some of the things that can happen when you have chronic ear infection and sinus problems. So let's talk about this. According to the CDC, we spend millions and millions of dollars helping kids with chronic ear infection. Okay, a lot of time the number one thing that they do is give them antibiotics. In fact, there was a study with 3,600 children found that children who did not take any antibiotics, you hear me right, had a higher rate of recovery than those who took antibiotics. So if you know any kids that ever had ear infection, what's the first thing they do? They give them antibiotics. For what? Because that's kind of what we do. Again, I'm not dispensing any medical advice, but there are other ways to do that. So despite that study showing that people recover at a higher rate, many pediatricians now continue to give medication, antibiotics, despite all that. That's what contributing what we call to antibiotic resisting bacteria. Okay, us as a society, any little infection, what we do is take antibiotics. So the more antibiotics you take, now it becomes resistant. So when you really need it, you don't have it. So when the antibiotic's not successful, guess what they do now? They put tube behind it, the ear. And that's a surgical procedure that requires anesthesia and create a small opening into the eardrum inside. And in most cases, the membrane pushes the tube out after a couple months. So they put the tube in and then it comes out. So that's kind of the main thing that they do. And if it doesn't work, then they continue the process over and over again. Unfortunately, the most children that have this procedure, the fluid comes back within a couple months, resulting in permanent structural damage to the membrane. And 40% of children who had ear tubes have even more problem, according to this research. So again, I'm not anti anything. What I'm giving you is just the information that the majority of the time when kids have ear infection, that's what happened. They have the antibiotics. After the antibiotics, and if that doesn't work, you get the tube. But majority of the time, that may lead to some kind of hearing loss. You get all these side effects from the general anesthesia and all that stuff. Again, if they need it, that's what they need to do. But I'm here to tell you that there are other ways that you can do it naturally, specifically what we do here in the office, which is called NUCA, which will explain a little bit more about what we do here. So a little stat here. According to the American Academy of Pediatrics, over 5 million children suffer from chronic ear infection, resulting in 30 million visits to the doctors and over 10 million prescriptions. 10 million prescriptions of what? Antibiotics each year. Half of the antibiotics prescribed for preschoolers are for ear infection. Symptoms of ear infection may include mild discomfort, irritability, fever, and severe pain. And almost 50% of all children will have at least one middle ear infection before they're 1 year old. And 2/3 of them will have an ear infection by age 3. Okay, I had to read this because, again, you got to get the massive thing that's going on when it comes to ear infection. Now, we're only talking about kids. We're not talking about adults yet, but kids. A lot of time with kids, ear infection and ear surgery and antibiotics and treatment is the second things only after circumcision. Okay, so if your kids are not getting snipped, then they get all these antibiotics for that. All right, so we'll talk about some of the things that we can do, but those are the main thing that typically happens with children under 3 or 4, where they have chronic ear infection and they have all these things that's happening, and that's when that's the normal treatment for them. So with the inner ear disorders that happen in adult, so when you have a problem in inner ear, that can cause things like dizziness, vertigo, nausea, of course, hearing loss, tinnitus, which I see a lot in my office, ringing in the ear. But these symptoms may differ from people to people. So just because you have that doesn't mean you're going to have all these things. But the common link with inner ear infection and injuries or trauma to the upper cervical spine. Hear me right. When we talk about all these inner ear infection, the most common thing and the link between all of these diseases I just mentioned, when we talk about dizziness, vertigo, nausea, hearing loss, ringing in the ear, tinnitus, all of these things is a trauma or injury to the upper cervical spine. So, well, my kids didn't have any trauma and injury. Do you know that the birth process is traumatic? I mean, kudos for those of you that did it naturally, because then they give the kid a greater chance. But a lot of time nowadays, we get the C-section, we get the aid with the suction, we get all these things. Birth in itself is trauma. Hence why a lot of kids may have chronic ear infection because of the birth process. Again, my kids, they're fortunate because the moment they came out, as soon as I got my hands on them, I checked the atlas. Again, I wasn't checking because they had any pain or any symptoms, but just to make sure as they came out, that the atlas is good. And I continue to check them to this day, making sure that the atlas is properly aligned, because that alignment is the connection between brain and body. If that connection is that interference, that can cause anything and everything. But we're sticking to inner ear disorders. Now, one of the things we see a lot in our office, which is kind of number one thing that happen when you have inner ear disorders, is vertigo and dizziness. Okay, so vertigo is kind of having a false sensation where you're moving or the world is like spinning. You just feel like you're spinning, and this can happen, some from time to time, and sometimes it can be severe, and it can happen for a long period of time where you have the vertigo for a while. And sometimes even when you're sitting down or you're laying down, you still feel that spinning, which can be, I mean, it can affect everything. The people that I see in my office with that literally can affect everything about them. But also, when you have vertigo, it can also accompanied by some of the things that we talked about. You have the vertigo can lead to nausea and vomiting, malaise. You have the hearing loss. You have the ringing in the ear. You feel that your ear is full of something or water or fluid, and it has a lot of pressure. There are several different type of vertigos. When we talk about vertigos, there's a positional vertigo where it's like a certain position may causes it. Where it's like whenever you sit up, you kind of have vertigo, or whenever you turn your head quickly, you have vertigo. You have a post-traumatic, something happened, you hit your head, then you feel dizzy. But of course, the main one is the cervical vertigo, simply mean that the dizziness is caused by the neck. And we'll talk all about that in a little bit. So dizziness and instability and balance can occur about 50% of all head injuries. So whenever you have any trauma to the head, approximately 50% of the time, you will have a dizziness, okay? Even the mild one that doesn't require the medical attention may cause to have a little bit of dizziness because you're shaking the brain. Medical literatures, vertigo can also be caused by hyperactivity or irritation of the joints and nerve in the upper cervical spine, which can affect coordination of the eyes, head, and body, as well as control, posture, and spatial orientation. So when we talk about posture, that's what we talk about all the time. How can posture affect your health? But bad posture can lead to dizziness and vertigo, because those are what control the nerves, the fibers that goes to the inner ear. So that can create vertigo. So if you or someone have vertigo, absolutely. Again, typically when people come see me, have you seen it at ENT yet? Fortunately, every single patient that I've ever seen that has these kind of symptoms have been to the ENT. They have gotten all their ears checked. They have gotten all these things checked. And typically there is absolutely nothing wrong with them. So that's when I know it's an upper cervical issue, because all the tests that they do is negative. Again, if you are out there and you have vertigo and dizziness and you've had checked by ENT, neurologist, your eye doctor, all that stuff, and everything's negative, but yet you're still suffering from that dizziness and that vertigo, give me a call, because most likely there is an issue with the upper cervical spine where the region where all the nerve fibers goes to the inner ear that may be causing what we call vertigo. Now, another thing that the symptoms that can happen whenever you have a ear disorder is what we call Meniere's disease. It's a fancy term, but Meniere's disease is accompanied typically by recurring disabling vertigo, like just like whirling sensation. That's even worse. That can also accompanied by hearing loss, typically in one ear, and tinnitus. So you can lose your hearing, but also have that buzzing sound. That's what tinnitus is, just buzzing sound constantly in one ear, and can last for days. Okay, Meniere's disease can really last for days. Most of the time, you're gonna have fullness in the ear, pressure behind the ear. Over the years, it may feel good, may feel bad, but it's that constant vertigo, tinnitus, fullness in the ear loss that can happen. And I've seen plenty of patients here with Meniere's. And again, we're not taking care of any Meniere's. We're not taking care of the symptom. We're not treating anybody. We're actually fixing the nerve supply that goes from the upper cervical spine to the eardrum that can cause things like vertigo. Now, if you guys have Meniere's, I used to have this book. I was going to show it to you, but I can't find it. I think I lent it to a patient and I haven't gotten it back yet. But it's a small book called What Time Tuesday. It's a green book, really great book that talks about how upper cervical care saved this man's life as far as having Meniere's disease. Meniere's disease is also called, trigeminal neuralgia is very different, But in this book, they talk about this guy called Dr. Kevin Brown, and he had Meniere's as a child. It was so sick that he fell to the floor with dizziness, hearing loss, nausea, and projectile vomiting. And he was told that the only solution was to destroy the balance nerve in the inner ear. As a result, he could never run, play soccer, go swimming. Worst of all, never go to bed without a light, because surgery would destroy the body's computer mechanism. So a shunt was put in his ear to reduce the amount of fluid buildup that helped with the hearing, but all the other symptoms remain. So it was missing about 90 days of school every year. Okay. Now, what happened is he regained his hearing within 15 minutes of his first upper cervical treatment. Very first upper cervical treatment, he got his hearing back. The upper cervical chiropractor gave him his life back, according to him, so that he could function as others. He gave him the ability to return to school and be part of the state championship soccer team, go to college, and and became a chiropractor himself. So again, read those books. Those are testimonial from real people that had Meniere's disease and was fed up with the treatment that they had. But a simple upper cervical adjustment, realigning the top vertebra, taking pressure off the brainstem, allowed him to get his life back. So that's one of the example of Meniere's. What Time Tuesday, you can get on Amazon. Really great book that's going to talk about the upper cervical spine and Meniere's disease. So inner ear disorders and trauma. There's tons of research with the relationship with inner ear disorders when we talk about vertigo, tinnitus, Meniere's disease, and trauma. So a lot of time, trauma can range from a tiny thing, a bump on the head, to a fall, to a concussion, whiplash from motor vehicle accidents, sports injuries. Inner ear disorder can immediately happen after trauma, or can happen years later. I've seen, again, as a former career as an athletic trainer, I used to work with a lot of football players and a lot of soccer players. Now, minor concussions that people, little injuries that happen may not cause anything at that moment, but overall, putting pressure on that brainstem when you're heading in soccer, hitting your head with the ball, doing a header, getting tackled, all of these things can be minor sports injury that later on can cause problem with the inner ear, because again, all the nerve that comes from the upper cervical spine that goes to the eardrum, if there is pressure there, that can cause buildup, which can lead to vertigo, tinnitus, hearing loss, and Meniere's disease. Okay, so the misalignment of the top bone in the neck is often can cause in kids by birth trauma that we talked about, which can affect the ability for the eustachian tube to open and close correctly. Okay, so that's why we are able to help kids with chronic ear infection and chronic sinusitis. Is because during birth there's a possibility that there was trauma there and affect the ability of the eustachian tube to open and close, but all those nerves that controls that are in the upper cervical spine. So when the eustachian tube cannot open and close, that provides an environment for bacteria to thrive and multiply. And that's the ideal situation for chronic ear infection. Does that make sense? Okay, so when your eustachian tube we talked about is not able to open and close, then the body cannot, it just creates an environment for bacteria. And now what's happening is you get the chronic ear infection, and again, the antibiotics may get the initial one out, but guess what? If you don't fix that eustachian tube, you get more infection. The tube goes in, but the problem was never a lack of antibiotic. It was never a lack of tubing. It's just because somewhere along the way there was trauma, and the trauma affects the nerve that goes to the eustachian tube, and now it cannot open and close properly, creating infection, thus giving you chronic ear infection. Okay, so that's why we are able to help with chronic ear infection with kids, because we're removing the trauma that might happen there. All right, so now here's what we talk about upper cervical and how we be able to help. Again, upper cervical care is all about making sure that the brain and body connection is intact. All right, whenever there's any trauma, injury, fall, anything that may happen. So the upper cervical area, when we talk about the atlas of C1 vertebra here, can you see that? All right, so the atlas of C1 vertebra is this bone right here. Okay, so whenever there's any kind of trauma, that can actually knock that out of position. Why do you think that is? And that's because every single bone, every single vertebra in the body has disc to it. The C1 vertebra is the only one that's freely movable. It doesn't have any disc below it or any disc above it. Also, it's the smallest vertebra in the body. It's a 2 ounce bone that's holding your big head that can go anywhere from 8 to 14 pounds. And also, whenever this goes out of position, it actually goes out of position up here. Force always travel to the path of least resistance. So whenever there's any kind of trauma introduced to the body, it's going to find the weakest point. And because this is the smallest vertebra, that force going to travel and knock this out of position. So it doesn't matter during birth trauma, doing sports, doing a fall, a car accident, whiplash. Whenever force enters to the body, it finds the weakest point and knocks it out of position. Now, that outlet's being out of position, unless it's severely rotated, you may not have any symptoms right away. But in the case of vertigo, just like we talked about, dizziness, that can happen right away. Okay, so now when the outlet's out of position in kids immediately after a birth trauma, that outlet's putting pressure on that brainstem. That's the region where the nerve that goes to the eardrums are. So that prevent that nerve communication to the eustachian tube, creating chronic ear infection. So same thing in adults when we talk about Meniere's and vertigo and positional vertigo, trauma, injury, fall, whiplash, etc., knocks out of position. Now, in cases of adults, it may take months to years before you see any of these symptoms happening. But that in itself, if that is present, we can help you. So when we talk about, when you have ear infection, you have sinus issues, I always tell my patients, have you been to an ENT? Because again, there are things such as other infections that can happen that can cause these things. So whenever a patient presents to my office with ear infections, sinus issues, balance issues, vertigo, tinnitus, I always ask them, have you been to your ENT? Have you seen your eye doctor? Because again, the eyes and the ears can actually affect balance. So if your eyes is off and is giving wrong information to the ear, you may have imbalance issues. So I always ask them, and 90% of the time they have actually seen their ENTs and they have actually seen their eye doctors. So that's when I know it's my turn, it's my job to fix that. Because if everything's clear, that's one of the things I hear in my office 24/7. I've done all the tests, I've gone everywhere, everything is negative, so there's nothing wrong with me, but I'm still having that same pain and that same issue. Then it's like light bulb, it's an atlas issue. Because there had to be some kind of trauma that shifted the atlas out of position. It's been out of position for so long, now it's creating those symptoms, and there is nothing wrong with you. So again, I always say this, if you are someone, you tried everything, that's the key word in my office all the time. I've been everywhere, I've tried everything, everything's negative, can you help? And majority of the time we can, because what we're looking for is not a pain and symptoms. We're looking to see if you have what's called an atlas subluxation complex syndrome. If that is present, we can absolutely help regardless of the symptoms, okay? So that's how an upper cervical chiropractor like myself can actually help with chronic ear infection and sinus issues, vertigo, tinnitus, you name it, by simply adjusting the top vertebra in the spine gently without any popping, twisting, or cracking to allow the body to heal itself. So now when you come in the office, we're going to sit down and really figure out what's going on with you. Again, answer the questions that whether you have any trauma, any injuries, anything happening, whether you've been to an ENT, what was the results, have you gotten an MRI. We're going to do a detailed consultation to really figure out what's going on. But when we're done, we're not just going to get you on the table and pop you and send you on the way. In the office here, we don't guess. We test. Everything that we do, we want to see objectively what's happening there. So we're going to do a series of examination to test the nervous system to see if indeed there is impairment between the communication of the brain and the rest of the body. We'll do a series of examination that looks at your nerve that goes to the muscle, surface EMG, thermal scan, that's going to check the nerve that goes entering to the blood vessels, organs, and glands. We'll do range of motion to see if there's any restriction in the body. We'll do heart rate variability, testing the autonomic nervous system to see whether you are in sympathetic or parasympathetic overload. Then we'll do a test that's going to look at your posture, because again, posture is one of the biggest things that tells me whether you're healthy or not. Because if you present in my office like that all the time, that tells me there is a misalignment here. So do yourself a favor, Posture, posture, posture. You want good health? Manage your posture, what we call structural integrity. Because if your structure, which is the spine, is out of position, it's impossible for the brain to communicate to every part of the body because there's going to be interference there. I like to think of your spine as high 95. Those of us that live here in South Florida, 95 goes straight down from where I am to Palm Beach all the way down. It goes all the way up the entire country on the east side. But that from here, if there's no traffic, you can go from here to Miami, from Boca to Miami in 30 minutes if there's no traffic. But if there's an accident in traffic, it'll take you hours to get there. So that's what we call a subluxation. A subluxation is interfering with traffic or creating traffic from point A to point B. So when the brain is able to communicate through the spine, which is 95, without any traffic, you're perfect. When there is any interference, any accidents that's causing delay between the signal that comes from here down to whatever organs, blood vessels, and glands is going to, that's what we call a subluxation, and that's going to create pain, symptoms, disease in the long run. So in my office, I'm not so concerned about the pain, symptoms, and disease because those are secondary conditions to what's happening here. So if we can get rid of the accident, get rid of the subluxation, then the communication will take place. And what the body does, the body is a self-healing, self-healing, self-adapting, self-regulating mechanism. So when we take the interference away, the body is going to be able to heal itself over time. That's why I tell my patient, I don't heal anything. I don't fix anything. I don't treat anything. The only thing that I do in my office is remove subluxation. In this case, we move atlas subluxation. By removing that subluxation, we're allowing the body to heal itself. In this case, we're removing the subluxation that's going to affect the nerve that goes from the upper cervical spine to the inner ear to release, to allow the inner ear, the tube to actually, the eustachian tube to actually close and open and close so you can get rid of the infection that's going to happen because of that. All right. So again, if you know someone that suffers from, especially kids that suffers from chronic ear infection, sinus issues all the time, they need to get the atlas evaluated. If you're an adult that has tinnitus, ringing in the ear, I've had tremendous amount of success with that. Vertigo, positional vertigo. Whenever you sit up, you get dizzy. Meniere's disease, trigeminal neuralgia, which is actually a problem with the trigeminal nerve, but since we up here, we're talking about it. All these things can absolutely be an atlas misalignment issue. Okay, so if you have been to your ENT and you have been to your eye doctor and there's nothing wrong with you because everything's negative, give NUCA a chance, because I promise you we can change your life. Okay, so right now I don't have any questions. I don't see any questions. So again, this is a short live because I really wanted to get to tell you people that what we do here is essential to your health. Okay, if you have those pain and symptoms that we talked about, we are able to help. So do yourself a favor, take advantage of the offer. Again, call today. Dana will be answering the calls, and we will give you a $200 gift card towards your entire examination. As always, our consultation is free. There's no charge for that. It's just a 15-minute conversation to really determine whether you're a good fit for what we do in the office. If you are, great, we can continue. If you're not, there's no harm, no foul. There's no sales pitch. There's nothing like that. I really want to see whether we can help you or not. So if you suffer from all these things, you just want to talk to me, call, make an appointment, and then you can come in and we'll do a consultation to see if you're the right fit for the office. Okay. But for those of you that are interested, as a thank you for taking the time out to watch this live, take advantage of the offer. It's $200 gift card that's going to go towards your first first visit as far as all the examination that we talked about. Okay. Now, what can I talk about? Oh yeah, June 8th, coming up. Our next live is going to be about back safety and injury prevention. Now, this is going to be a good one because most of you already think that NUCA or chiropractor is all about back and neck pain. So we're going to teach you how effective that chiropractic is about taking care of back pain. But also, I know a lot of you are thinking, well, wait a minute. How can an atlas adjustment here, doc, you're actually touching up here, how can that affect my back? Well, it's all connected. Your back is connected to, everything comes from above, down, inside out. So if there's any interference above, it's going to affect down. So we're going to teach you how an upper cervical misalignment can actually fix your sciatic pain, your back pain, how to prevent injury. We'll talk about posture, how to prevent back pain when you're sitting at the computer doing Zoom all day, when you have a car accident, all these things. So come on and tell your friends, tell everybody. It's going to be at the same time, Thursday, June 8th at 1:30 to 2:30. And we're going to have a lot to talk about. So again, any question for just a quick review as far as the chronic infection. So the way the body's designed, you have the outer ear, you have the middle ear where the eardrum is, and then you have the inner ear that actually from the eardrum that goes through the eustachian tube. The eustachian tube actually goes all the way down, and then it goes into the cavity here where it goes to your nose and goes down all the way to the esophagus. So when somebody have chronic ear infection or chronic sinus infection, that's what's happening. You have all these sinus here, and you have this congestion that happened here, and it typically can drain down. That's because all these things are connected. Now, what controls all these things are the fibers or the nerve that comes from the atlas here. So the atlas houses the brainstem. So whenever there's any kind of trauma that puts pressure on the brain or the brain stem, that can affect all these things, creating chronic ear infection, chronic sinus issues. All these things can happen because of that. So if you, especially living in South Florida, you always have sinus infections, let's check to see if it is indeed an atlas subluxation complex. Kids, if you have kids and they're constantly having ear infection and you thought about giving they constantly on antibiotics, you thought about doing the tube, and even after the tube, they still have these issues, that quite possibly was a trauma that happened within the birth during the birth that's causing pressure to be applied on those nerves that goes to the eardrum, that's preventing it from opening and closing, which can create bacteria, which can lead to chronic ear infection. So it's never a lack of antibiotic that may cause that. Is because trauma leads to inflammation, leads to misalignment in the upper cervical spine, which affect everything else. So also ear infection, inner ear infection or inner ear disorders in adults usually starts with vertigo or dizziness. Then it may cause vomiting, hearing loss, tinnitus. That's another thing. A lot of time people are like, well, I have decrease in hearing. I can't hear you properly. It might be an upper cervical issue because those nerve that goes to the ear comes from the brainstem. So if you have hearing loss, tinnitus, and all this stuff, again, that can be an atlas misalignment. Specifically, if you had any kind of trauma, post-traumatic trauma can actually cause that by pressure on the neck. Meniere's disease is a disorder that's usually happen all the time, but usually have vertigo attached to it, where you feel that whirling sensation, hearing loss, of course, tinnitus. You see that all of these things have kind of the same symptoms: nausea, vomiting. Those can last anywhere from 2 hours to pretty much days. Sometimes you may have the fullness. And I had one, I guess, if you go back to my YouTube, there's a testimony of this gentleman that came in with Meniere's that had for years troubling him, just really was bothering him and decreased his quality of life. And I believe after the first adjustment, he started feeling better. Again, don't everybody respond differently. Doesn't mean that one adjustment is going to fix it. But if it is an atlas misalignment, we'll be able to help you with that. Okay. So if anyone has any questions that wants to talk to me, I'll be here for another minute. If I don't have any questions, then that'll be the live. But please keep in mind, call today. Call your friend and tell them you just saw the live. You should go see an Atlas chiropractor. And today only is $200 gift card towards your initial care. So give us a call. And as always, Dr. Jean-Pierre, if you have any questions, even though the live's over, you can always reach me on social media here on YouTube, Facebook, Instagram, or you can always shoot me an email at uppercervicalinstitute@gmail.com. I welcome any questions. I will take the time out to answer any and all questions. If you are out of state or anywhere and you want to find a NUCA doctor, give me a call and I will find the best person to connect you with. Unfortunately, there's only 300 of us in the world that does this kind of work. I have people that travel from all over the world that come see me here. However, there are other NUCA doctors throughout the entire country that I can connect you with if they are in your area. All right. So again, one of my favorite quote, this is what I end with. One of my favorite quote is, you never know how far reaching something you may think, say, or do today will affect the lives of millions tomorrow. This quote was by BJ Palmer. That's one of the quotes that I always keep in mind because again, be kind. You never know how your attitude towards somebody else will affect them. Sometimes a smile can go a long way. Sometimes a thank you, please opening the door can go a long way because you don't know what's going on. So again, I do these lives, take the time out because I wish somebody had educate me on this. Otherwise, I would not have suffered 20 years with migraine because it took me a while to find NUCA. So again, I'm going to be doing these every 2 weeks on a Thursday from 1:30 to 2:30. If there's any topic that you'd like me to talk about that you're curious about, please send me an email, uppercervicalconsult@gmail. That way we can put in rotation and talk to you about it. Tell your friends, tell your loved ones, Dr. Jean-Pierre, I'm out. Have a good one, guys. Love you guys and see you next Thursday. Bye.